Good afternoon, everyone. Thanks so much for joining us. This is Macy Morris from the National Association of Regional Councils. Thanks so much for joining us today. We're really excited to have this latest webinar in our COVID-19 webinar series. I guess over the last couple weeks, I don't know if you've all been on any of the webinars lately, but we've just been holding a lot of webinars on a lot of different aspects of the growing coronavirus situation. Some looking externally, like at how regional councils have been responding to the growing pandemic, but also looking internally as we had a webinar last week directed towards IT managers. So this is just the latest in a series, and thanks to our growing and very active fiscal officers group, we thought the next one should be looking at fiscal and HR considerations for regional councils. So really excited to have you all on today to have that discussion, and I hope that it'll be not just me asking you a bunch of questions, but an engaging and interesting conversation about all the things that are on your minds and how you're getting through this new normal that we're all involved in right now. So a few housekeeping items just before we get started. So I am going to try, there's a lot of you on today, but I'm going to try to unmute your lines. So if you do want to take part in the conversation, you will have the ability to. So I just ask that you please have yourself on mute if you're not speaking. That way we can be respectful of others that are currently talking. And if you prefer not to speak, or if you just prefer to submit a question, feel free to use the questions box. It should be within your GoToWebinar box of different resources there. And yeah, I think that's it. If you have any technical issues or would like to send me an email, feel free to do so. It should be on the screen there. So with that, we'll get started. I'm going to unmute all your lines real quick, and we'll see how this works. If it doesn't work, then we'll try something else, but it sounds like everything's okay so far. Okay, so I guess we'll get started. I do have a few questions here to help get conversation started. So my first sort of question that I would be interested in hearing, and we'll see how conversation goes from here, is what programs and applications are folks utilizing to keep in touch with your colleagues and associates? And if there are any favorites that you've came across as you've been working the last week or two remotely. So if anybody wants to jump in on that question, I'd be happy to hear it.
Macy, this is Carol in Mid-America Regional Council in Kansas City.
Yes, ma'am. How's it going?
Good.
Yeah.
So it's 3 o'clock our time, and I've had 5 meetings today. The first one was a conference call. The second one was in Zoom. The third one was GoToMeeting, and the fourth one was Teams, and the fifth one now is GoToWebinar. So I guess people using Skype also. So I guess my answer is we've been trying them all, and I think as time goes on, we'll learn which ones work better for which kinds of things. But I guess one observation is the things that are internal and for small, quick meetings of staff or even department staff meetings, I really like having people's faces because we all miss being in the office together. So that's helpful in that regard. But we're using everything, so that's my input.
Okay. Yeah, I think as time goes on too, we've been using a lot of different ones too. I think our favorite, just personally for NARC, is Teams, just because we can see each other and it's nice to visit in with everybody, but we definitely have used a number as well. Does anybody else have any other ones that they're using? No? see. Okay, I do see some comments here. Somebody said that they're using Zoom and GoToMeetings, which is good for including external guests that aren't necessarily internal, which is a good point to make too, because I know a lot of you are looking at how you're going to have meetings with board members and with others that are outside your organization. So that's interesting too. Thanks for the, and I see Robert too. Again, just like Carol, just using a lot of different things, trying to see what works out best. Zoom, Teams, GoToMeeting, and GoToWebinar. So that's great too. Does anybody else have any other ones that they would like to? Oh, here's another one from Susan saying that Microsoft Teams has been great, which is good because we've had some on the past webinars too that said Teams has been really helpful, and I know for the NARC team it has been too. Rosa saying that it allows Microsoft Team allows people to work on assignments together, which is great. It's something that we really like as well. Kevin, our co-chair, uses Microsoft Teams and also Skype within Atlanta Regional Commission. And now, Google. A lot of people using Google Hangouts. That one's a new one that we haven't heard yet. Really user-friendly. Yeah, so those are different ones, and CMAP too, also using Teams and GoToMeeting. So it's good to hear that we're all sort of using the similar ones, and it seems to be working for everyone using these different applications, I guess just depending on who you are communicating with. So that's great. So maybe we'll just go ahead and jump to the next question that I have here, unless somebody wants to jump in with another one. So I know that teleworking is sort of new for everyone, especially the whole office, telecommuting. So just wondering what your teleworking processes look like. If there's any, did you institute any official policies that maybe you could share with the group, or how did you make that transition from sort of all being in the office to all being still active but online at home? How did that look like? So I do see Paul raising his hand. Let me see if I can work on his real quick. If anybody wants to jump in the process.
Can you hear me?
Yes, I can hear you.
Okay, so Paul Cavarese, Broward MPO down in Broward County, Florida. We activated our hurricane coop, which had a telework policy in there, so it's not our policy.
All right, go ahead.
Okay, our policy is really being activated at the emergency side, and we are kind of backwards engineering our standing telework policy.
Thank you. Did anybody else want to jump in on this question, or and if you're having trouble, if for some reason it's just you're trying to talk and it's not allowing you to, just raise your hand, use the raise your hand application, and I'll try to unmute you. Kelly, I just unmuted you if you want to jump in.
Yes, nice. I'm Atlanta Regional Commission, and we've been teleworking for probably over 10 years. And I know that's probably, it may be a little bit different than everybody else, but we've really been able to use what we've all done, the same situations where people were using Teams, communicating, we've been doing that. But we've also found that how we've sorted our documents and file our documents and being the prep for that has really made a huge difference. So we know where everything is. So if you're new to it and the centralization really probably helps a lot. But we are using Teams just to talk to each other occasionally, and also to demonstrate, because I'm trying to let other people take over more of audit stuff. And so the Teams and sharing the screen has really allowed me to be able to teach them or instruct over, since we're not in the office. So that's helped a lot.
Great, thank you. Just unmuted Tawana, if you want to jump in.
Bella, you gotta stay down. You got to stay down. Then. Yes, I know you want up here, but no.
Okay, we'll go ahead and go to somebody else then. Jennifer, she wrote in that said we have policies. The agreements between the executive director and the employee is made up of 4 parts: agreement, policy understanding, security understanding, and safety understanding, which great. So Robert jumped in and said it's been a little chaotic. They started with a test remote day using Splashtop. Would definitely love to hear more about that, Robert, if you'd like to talk about that a little bit more, because I've never heard of Splashtop.
No.
I don't know if others.
I really can't have you up there. I'm down here.
There's, and Robert also says, not many employees are working using remote access, and we're in the process of putting together processes. And TJ Cog shared a telework toolkit a while back, which I'll be sure to share with you all, but it sounds like they have resources put together that are interesting. And then Robert says Splashtop allows us to remotely access their work computers from home. So that's interesting application. Interested to hear if anyone else has used that as well. All right. I see some people are trying to jump in. I sent an audio pin to Nancy and to Deborah, so hopefully you see that and we'll be able to jump in on the conversation. But until then, I will just go ahead and maybe jump to another question. Let's see. So I know being the person that does the job postings and job listings for NARC, a question that came up for me earlier today was what, for those who are hiring or those who are onboarding new employees, how has this impacted your processes? Have you seen more people trying to apply for jobs because of, the unemployment rate seemingly dropping week for week? Have you seen a drop off just because people are staying home and staying safe? So I'd be interested to hear you all's experiences with that, and if you've hired anybody new recently, what that potentially looks like. By the way, Deborah, I think you are officially unmuted now.
All right. Can you hear me?
Oh, there you are. Yes. Yes.
Oh, all right. Well, I'm trying to wear headphones, so I'm also not listening to all the background noise in my house, but I wasn't sure if you could hear me through them. Okay. Well, we went remote working on Monday. It was our first time, and we had not really ever worked remotely in the finance department. Now, we had some construction at one time where we had to move all of our like support brokers and case manager kind of folks working remotely. So we did have a little bit of experience in that situation, but we are using VPN to access our computers at work. We are finding, not all of our internet access is the same, and not everybody's is great, mine being one of them. So it is a little bit of a challenge for us.
Yeah, that's really interesting. Because I imagine, I know if I were living back at home, I would have a tough time doing that as well, just because, lack of access to high speed broadband. So I see that Nancy is jumping in on the questions box. Thank you, saying we're working on the onboarding process now. We will be using the DocuSign application to help get documents signed. We'll then host a Teams meeting with the new employee, which is great. So still get that face-to-face time with them, even though it's not directly in front of one another. And DocuSign too. That's good to sign the official documents and hopefully get them on their way. So what an interesting way to start a new job. Interesting timing.
I'm sorry, baby. I know.
All right. Anybody else want to jump in on this question before we move on to the next one? So again, if you're trying to speak and it's just not working for some reason, either send me a question or be sure to raise your hand so I can see it and I can see if I can try to help you help unmute your line. All right, well, hearing none, maybe we'll jump on to the next one. There's a lot of questions going around about the timing of all of this, hearing from the Trump administration saying that they want to open back businesses up as soon as or close to Easter as possible. There's some folks talking about, there's some schools, like here in Virginia where I live, schools are going to be closed for the rest of the year. And I think in DC and Maryland, I think they're closed at least until April. So a lot of questions about how long is this new normal going to last? So I would be interested to hear with what you all are sort of planning for. Are you just taking it day by day, week by week to see how it goes? Is there a certain deadline that you're adhering to? Just love to hear your all's experience on that and what you are thinking. So I see that Paul has his hand raised again. I don't know if that was purposely done, but I tried to unmute you anyway.
Hi, sorry, that was an accident. But
no problem.
But just to let you know, we're reassessing every 2 weeks.
Oh, that's good to know. Okay, I think that's kind of along the lines of what NARC is doing, doing it week by week. But as more news comes out, definitely looking at later and later. So Robert says that we're voluntarily isolating now, but it could become mandatory. Definitely not day by day, but more by weeks, which makes sense to me as well. So, it's hard when people are, when you have things like conferences or awards dinners that are, just far enough out of reach, like in May or in June, where you think it might end by then, but it's not sure. So I know this is a hard time for a lot of us, not really knowing what the future is going to hold. Elizabeth, I did unmute your line in case you wanted to speak in, but I know that you have, you wrote in the questions box that you're actually at a safer at home order. So you'll continue to work remotely until that order is removed, which is a great point to bring up too, because I know some of our regions are experiencing that, some of you are under mandatory sort of lockdown. So I don't know if that's the case for everywhere, but I think there are 24 states where that's being sort of enacted. So would be interested to hear what your all experiences with that too, if you are one of the places where there's voluntary or a mandatory home order, sorry. So I see Angela from Chicago saying, in Chicago, schools are closed until April 20th. If companies and organizations are open before Easter, we'll need to revisit what the impact will be for employees that do have children. The expanded FMLA policy is available for those employees. So that's interesting. Yeah, the child care aspect, I'm sure, is key for a lot of folks. Right. Right. So maybe last call on this question and see if anybody else has anything they would like to add before we move on to another topic.
Okay. Yeah, Macy, here in Kansas City, we're on our 9-county region, and others adjacent to us are on a 30-day stay home. We're calling it Stay Home KC. So, and the schools are canceled for the rest of the year. And I think they're reevaluating it within the 30-day period, but based on what our folks who are kind of out in the trenches think, will be probably extending it beyond the 30 days. And we've canceled everything through May and some in early June.
That makes sense. Kevin, your line's unmuted if you'd like to join in.
Yeah, I was just going to say that we've instituted teleworking through the end of May. Originally, we were up through the end of this week, and we're going to give an update at the end of this week. But our executive director, Doug Hooker, and I and the leadership team basically made the call based upon kind of reading the news and hearing sources locally at the national level said it's smarter to make the call ahead of time to do this up through the end of May at least. And then before then, make the call for what comes next. What would June look like? Either we are still in the same status or choose to work from the office after that if it's safe. In the interim, I was going to mention this before. We are allowing our person who has been kind of our head of general services or facilities within the agency. He has been doing a weekly checkpoint with our mail to make sure any urgent mail that may have come through that could not be somehow automated or scanned or what have you is collected and distributed. And some employees that do have urgent packages are then agreeing to meet and still keep social distance in distributing the mail there and then providing that mail to others around. So that's sort of an ad hoc process we've had to keep the mail going.
Great, thanks. All right. It seems like we're getting a little bit of feedback from the line. So if there's anybody that is not on self-mute, if you can mute yourself, that would be great. Thank you. Right. So maybe we'll just move on to the next question unless somebody wants to jump in and ask one of their own. I don't want to monopolize the conversation. I think somebody did write in a question earlier, so I will go ahead and go back to that real quick. Okay, so somebody asked, Tawana said, please advise on the impact of HR 1602 Families First Coronavirus Response Act on MPOs with staff under 50, paid leave and extension of FMLA. I personally don't know the answer to this, but if any of you all have seen this or if you've had conversations about it within your organization, it would be great if you could share what you know about this particular effect.
I can answer
maybe,
to that. This is Libby at SewerPack. I can answer some of those questions.
great, thank you.
The extended family medical leave is for employers that have less than 500 employees, but more than 50. So I don't know if any of you have less than 50 employees, then you don't need to offer the extended family medical leave. The extended paid sick leave is for all employers that have less than 500 staff. So there is not a 50 or 25 employee limitation on that. And that is employees are allowed to get 80 hours of paid sick leave above and beyond their normal sick leave. You can contact me at SewerPack if you have questions. I did sit in on a webinar on this yesterday, and I also have a PowerPoint presentation that I could pass along to you all as well if you would like it.
Hello?
Great. Hi, Angela, is that you?
Yes, I wanted to just make one correction because I've actually been involved in a lot of conversations about this. In fact, I had to read all the regulations to get our executive director up to speed. But my understanding is if your organization employs less than 50 employees, you need to request an exemption from the policy if it creates a financial hardship for your organization to physically implement. So it's just not an automatic exemption. You do have to request the exemption.
Great, thanks for that clarification. Really appreciate it. And somebody said, please share a seminar on the extended leave and FMLA. Thanks. From Vanessa.
Lucy, I'll send that to you and you can just send that out. How's that sound? Maybe that's the easiest thing.
Yeah, that'd be great. If you can, email it to me, I can definitely send it out tomorrow with all with the recording of the webinar as well.
Yep. Okay. No problem.
Great. All right. Let's see. So maybe we will just move on to. Oh, and then Paul shared a link from SHRM on a policy template that is helpful that we can send it out as well on the FMLA leave expansion emergency paid sick leave policy. And Vanessa, I think you had a question. Go ahead and jump in if you can. You should be unmuted.
Okay. Hi. Sorry, I just have a quick question on the extended sick leave policy. So if an organization have an existing sick leave, does the employee have to take the accumulated sick leave balance that they have first before they can take the extended sick leave, or is that above and beyond? Can you hear me?
Yeah, we can hear you.
Yes.
Hello?
Yes.
This is Angela. I can answer that if she wants.
Okay.
So they're not required to take their bank of sick time in advance at all. This is they could use this in advance of using any sick time available in their bank, effective April 1st. So you can't enforce that they take any time that they currently have. They could use this in lieu of.
Okay, so basically we're going to be double paying them?
No. They would take the extended FMLA and they would get paid under the provisions of that. They wouldn't get paid their personal time, vacation, or sick time in addition. It's one or the other. They're not required to take it. It's not one, it's one or the other. It's not both. But they're not required to take any time they have banked up.
Okay. So
Now, my thought is that most employees will probably take their personal and sick time that they have in the bank, because if you look at the guidelines, they're paid at a lower rate. So it will have financial implications if they use the expanded FMLA policy. So for that reason alone, a lot of people may just choose to use the time that they have in their that they have saved in their sick time bank.
So I thought the first 10 days are guaranteed at the regular rate for up to 80 hours.
It's
And
a cap, so it depends on what the employee makes. The cap is, I want to say, $511 a day. So if you have an employee that makes more than that in a given day, then they would cap out. They would only be paid up to that cap for the first 80 hours. After that, depending on the reason that they're taking the FMLA, they would be subject to a 2/3 of their base salary. And even with that, it's still capped at $200 a day. So there are some caps in place, regulation.
Right. So for employees that make, less than $511 per day, and they choose to take the sick leave, the extended sick leave, they will be paid for, let's say they make $300 a day, they will have a full pay if they choose to take the extended sick leave and not using their bank sick leave. They can do that, right? And get a full pay.
Correct, yes.
And
correct.
in the meantime, when they are taking the extended sick leave, they will continue to accrue for their PTO time, right?
I can't answer that question for your organization. I think it would depend on your organizational policy.
Okay. Thank you.
Unfortunately, I've spent a lot of time in the last 2 days reading these regulations, so I know quite a bit about it. I don't know if that's good or bad.
Yeah,
That's probably good. A lot of people will come to you for questions.
It would be really helpful if you could, kind of summarize the schedule and send it to Macy so she could distribute it to all of us. That would be awesome.
I've got something better than that. I actually went out onto WHD's website, and the poster is available. And if you read the poster, it is phenomenal. It answers all questions. It's an easy read. I can send that to, and we, because you're required to publish it as of April 1st, but the one-page poster summarizes it completely.
Oh, that would be awesome. Send me a link. Send us a link.
Yeah,
Okay.
if you can send that,
I sure.
definitely out.
Clean them out, and then and I can work. As long as it's.
We did have somebody else ask the question as well on this before we jump on to the next section. John asked, who is going to pay for this new sick leave and EFLMA pay? If anybody knows the answer, would like to jump in on that.
I can answer that again if you want.
Sure, yeah, go ahead.
So I guess it depends on how you're structured. If you're considered government, then you pay it. If you're considered private, then you pay it, but you would be eligible for a tax credit dollar for dollar on the amount you've paid. So it depends on how your organization is structured. If it's considered government, federal, state, or local, you pay it. You're not getting anything back. If you are private and you pay it, you're eligible for tax credits at the end of your fiscal, I believe it's the end of your fiscal year.
So the governmental entities just cough it up with no reimbursement? They don't get
Correct.
I thought they got a tax credit off of their off of their benefit, their contribution at the end of the year. That's not right?
The tax credit is if you're a private company and you file, tax returns, you get the credit then. If you are considered government, you get nothing back. So that's why I'm answering the question, because I don't know how a lot of the organizations are structured, but like in Chicago, we're considered government. So we pay, there's no credits for us to get. We're not getting any reimbursement, no tax credits. But if we were structured as a private entity, when we file our tax returns, we would be eligible dollar for dollar to get a tax credit.
Do you have the indirect rate cap, the indirect approval rate upfront, and the fringe rate upfront that you can only bill up to that max?
So that's a good question. We do have negotiated indirect rates in Chicago. And so I haven't had a conversation with our cognizance agency to talk about the implications of that, because we would go above potentially our indirect rate. I'm sorry, we would go above our fringe rate, I think. I'm sorry. So I haven't had that conversation yet. But I would think because it's a federal mandate that they would be, it's a federal mandate, they would have to waive that requirement.
Hey, Toddy.
Yeah.
Hey, Toddy. Fine, how are you? Yeah, for the most part. I'm on this, the NARC has one of these,
just another
phone calls.
reminder, we are getting a
Not
little
great.
bit of feedback on our line, so if you are not unmuted, please
I would
mute
actually rather
yourself
talk to you.
cut down on that. Thank you.
I'll tell you later. Some of it was just somebody else is on the phone. Somebody else from DVRPC is on the phone on the call. They're asking questions that they shouldn't be asking. Anyway, no.
Okay, it sounds like somebody's having a side conversation, and we can hear what you're saying. So if you want to unmute your line, that would be great. There was somebody else that did say, Debbie Cook said public entities specifically excluded from the tax credits, just to add on, I think, to the conversation already being had. All right, so maybe we'll just move on to something, a different question. Thanks all for participating in the FMLA conversation. I know that's something I don't know a lot about, so appreciate the extended conversation that we had on this.
Yeah, sure. I didn't know I had one.
Okay. I think I found the culprit, so I muted their line. Okay, another question here. So I know that states and localities are, being financially strained by everything that's going on with the coronavirus situation, and so they're taking a big hard look at their budgets for the rest of the year and for next year, with concern that they may not be able to do as much as they would hope to, just because of financial constraints. So I'd be interested in hearing from you all your concerns or regarding your own budgets internally, if you see that this is being a factor on that, how you're planning on working to mitigate the impact of the coronavirus onto your budgets, or if this is even an issue for you all. So I know that's a pretty loaded question, and I don't know if that's necessarily something you're thinking about yet, but if you are, definitely would be interested in hearing more about what you all think about that.
Casey, I'm sorry, but I just didn't really understand your question.
Oh, that's sure. Let me ask it maybe in a different way. Do you think that the coronavirus is going to have an impact on regional council budgets for the rest of the year? Do you think it'll have any sort of effect, or do you think that I guess thinking about, federal or state grants, maybe money not coming in as fast as you'd hope, or I don't know, just thinking about how it's going to impact the budgets of the state governments and maybe the local governments, and thinking about whether that'll have an impact, or you think it might have an impact on the budgets of your particular organizations as well. And it may not, just something that I thought about is.
I'll jump in on that one. This is Nancy Hollister with HGAC, and I think it's going to have a huge impact, primarily for all the workforce programs, the people that are now finding themselves out of work. At HGAC, that is our largest program, is our workforce program by a lot, and I expect it to just explode. They're saying that if this doesn't subside fairly soon, that we could be looking at 20% unemployment rate by the end of the year. If that happens, I think that it will have an astronomical effect on workforce programs, and we'll be trying to place people in jobs that are frankly not there. So yeah, I think it's going to be very impactful to our budget.
Sure. Yeah, that unemployment rate is scary to think about. In case folks just haven't heard, there are some reports that it could be as much as 20%. I think I saw a statistic today that 14 million people might lose their job before the end of the summer. And I think Goldman Sachs reported that 2.5 million people had reported for unemployment last week. So I think that'll be a huge factor in this, looking forward and looking towards, not only just the summer, but the rest of the year too. So does anybody else have any thoughts they would like to share? Any particular programs they see it might impact more than others?
One more thing, I think it will have a ripple effect. I think governments will be strained because of their tax base not being able to pay tax, and because they're unemployed, and that has a whole ripple effect. And governmental entities will start looking at their discretionary spending, including membership dues to regional councils. So I think that there's a very good possibility that times are going to get worse before they get better.
Definitely, yeah. I didn't even think about membership dues for local governments to regional councils. I'm sure, especially those that are in small areas that lack, resources or capacity, may take a critical look at their ability to participate. So that's a scary thought. Hopefully it won't impact any of the folks that are on the call, but something to certainly think about and something to consider as you're moving forward, and ways that you can work with your local governments to try to mitigate that as much as possible. So thanks, Nancy. All right, well, maybe I'll just ask one more question here. I think maybe I'll just start with end with a more positive one before we open up to questions from other folks, if anybody wants to jump in with any particular things that are on their minds. So on some of the other webinars, we've talked about how your organization has been working to keep up employee morale, because I know working from home, not being able to leave the house, can be a little hard to deal with sometimes, and you have, it's just a very overwhelming time with the seemingly bad news every hour. And not being able to get out as much as possible. So I'd be interested to hear if any folks have any programs or anything that they've been doing to help maybe bring their coworkers and colleagues together for a more positive note. And if anybody doesn't think of anything right away, I can share a few examples that I've heard recently.
Macy, this is Kevin. Can you hear me?
Yes.
Yes, we've actually been trying a number of things with what seems to be a decent amount of success, just in terms of maintaining morale and sort of boosting spirits during what was a fairly
Okay, bye.
Kevin, I think you cut out. I don't hear you anymore.
abrupt change to ways of working. You know, instituting things or encouraging teachers. Can you hear me? Can you hear me?
Yes,
Hello?
I can hear you now.
Uh-oh. Am I cut out still? You got me. Okay.
We can hear
We're encouraging our leader. Oh, I'll type it.
Okay. Well, while he's typing, one of the things that HGAC is doing is we are starting a wellness initiative on Monday or sometime early next week. And it is encouraging people to get out and go for a walk or get steps and do exercise. You know, we're not trying to get people in large groups, but individuals can take a walk around the block or that kind of thing, ride their bike. So the whole point of this thing is that people will be able to keep track of it, report it in the app, join a team virtually online, and then in about 6 weeks, which is how long the wellness program will last, we will award prizes to first through third for individual effort and the first place team. So I think that it's been a little while since we launched something like this for our employees, and I think they will really enjoy it. It's been successful in the past, and we just really think as an organization, at least upper management believes that getting some exercise is real stress relieving. And our employees, we're sensing, are feeling pretty stressed.
Great. Just to ask, what are you doing your wellness challenge through? Is it like an app?
It is. It's an app. There's a third party entity. I'll send you the link if you'd like it. But for the organization, I think it's going to cost us like $2,000. It's not very expensive, and employees can go online, track what they're doing. It gives you recipes for healthy meals. Every time you reach a milestone, then it gives you the app that we're using is, I think it's called Spring Forward. Everything in it is spring related. But I think that all we're trying to do is get people to focus on not just work and the dismal news, but to take care of themselves and get some sunshine and fresh air. And we think that's healthy. So that's what we're doing.
Great. No, thank you. Yeah, that'd be great if you could pass that along too. We can pass it along to folks. I think that's good. And we've actually just started one for NARC as well. So we started on Monday. So we'll see how that goes. I wish the weather was more cooperative, but trying to get people to get outside and walk around the neighborhood is great. I'll throw in a couple more, and hopefully maybe we can get Kevin to get Kevin's line working, he can jump back in. But since a lot of you are using things like Teams and Zoom and things where you can have face-to-face interaction, a couple of members on previous calls have mentioned that they have, one said that he has like a water cooler hour where they have the opportunity to sort of just chat about general things, not necessarily work-related things, but just kind of catching up with everybody and seeing how everyone is doing, and a nice way to sort of just relax a little bit in the midst of the work day. Another one that we heard was having like an happy hour or a coffee hour, and sort of doing the same thing, but all just sharing a mug of coffee at the same time, or a drink after the end of a day, just to sort of check in with everybody, and just, I don't know, a more fun way to make it feel like we're more normal than what we are, and you know, boost the morale. So we thought those were great suggestions, and definitely would encourage folks to think about doing that on their own as well. Sounds like a fun way to bring people together while we can't leave the house. So does anybody else want to contribute any ideas? Or Kevin, if you want to try again, definitely would love to hear from you.
Can you hear me?
Yes.
Okay. Yeah, I typed a few comments there in the comment section or in the question section. But yes, it was. I echo what you had shared. We are doing virtual lunches. People are sharing lunchtime with each other to do that, catch up a bit more socially. We are asking folks to share teleworking success stories around how they're able to kind of negotiate and navigate teleworking, and how they've been able to either problem solve or you know, make the best of working remotely during this time. Also encouraging people to, I'll be hosting a happy hour with my team on Thursday, tomorrow, in the same vein as what you were kind of talking about, the coffee hour or water cool hour, just to kind of talk about non-work stuff and hang out and use our video camera to make sure we're making some eye contact with folks. Also, we've asked folks kind of in real time to share pictures and stories of their new quote unquote coworkers, you know, their family members or their pets, or, you know, their plants, whomever that they want to talk about and share about that is now in their new workspace, so that we get a little bit more comfortable, you know, in the workspace that we're in and being a part of it, and making sure people are comfortable knowing that that's the case. We're fortunate in that we've got a program here in Georgia called the Georgia Commute Options. There may be similar partner programs in other states where it is encouraging commuters to use anything other than single occupancy vehicles. And that team has put together a teleworking presentation that has gotten pretty wide acceptance with other corporations and other agencies that we partner with in our region. So we've given that locally with other partners, as well as within our own agency, to help give tips on everything from managing your team remotely to, you know, as we've been talking about, ways to improve the culture, as well as the technicalities and tactics of, you know, using Teams and using Skype and using Zoom, et cetera. So we package that into a presentation that has been very helpful as well.
Great. Oh, thank you. Yeah, that sounds like a lot. That's really great. And yeah, those topics are definitely timely and interesting to talk about. And I know this is new for a lot of people, teleworking and managing people remotely. So that sounds great. Great. Well, we're coming up on the end of the hour, so I would just like to open it up to anybody else. If you have any other thoughts on your mind related to, you know, fiscal policy within your organization or HR considerations, if you have any questions that you would like to ask your peers before we head off the phone.
Bless you. Thank you.
Somebody trying to ask a question? Sorry. Okay. Well, hearing none, and I don't see anything in the question box, we'll go ahead and hang up for today. But be sure to check, look out for your email. We'll definitely send out a recording of this conversation and some of the resources that we talked about on the phone today. And I'm sure for those who are involved in the fiscal officers group, Nancy and Kevin and I will have conversations about how we can keep this conversation going, because I know as the longer that we go on with this process, the more things I'm sure there will be to consider and the more best practices that'll be collected based on everybody's experiences with telework and how this situation will impact your work long term. So if you are not a part of the fiscal officers group and would like to be involved, I mean, we talked about fiscal policy, but we also talked about human resources as well and general administration, since I know a lot of you wear many hats within your organization. If you're not involved, feel free to reach out to me. My email again is on the screen here, and we'd love to have you involved in part of our conversations that will be kicking off again really soon. So would love to have you involved. But other than that, thank you all for joining us this afternoon, and we will talk soon. Thank you.
Thanks, Macy.
Thank you, Macy.
Thank you.
Thanks, Macy.
Thanks, Macy.